All right, and welcome everybody to the Medicare Audit Documentation webinar. We have asked Francis Powell from MEA to give us a presentation of their FastAttach product, and we'll look forward to that. But first of all, we'd like to share a couple of polls with you, kind of see what the people who are attending think about Medicare audit documentation and how they are using that. The first question is, what are you most interested in esMD? That's the Medicare term for electronic documentation. What are you most interested in that for? 1, the DME MAC audit requests. 2, responding to the RAC audit requests. Number 3, responding to or providing the prepayment additional documentation requests, the ADRs. Or number 4, other CMS audits, whether they're CERT, PERM, ZPIC, or the the PMD prior authorization requests. Those are primarily the audits that we're getting and the documentation that is possible to have provided. We got 60% of the people voting already. Go ahead and lock in your votes there, and we'll share that with everybody. Give you just about 5 more seconds. All right, we're going to close the poll here and share that with everybody. And people are mostly interested in the DME MAC audit requests, but then very close behind that are the RAC audits and the other audits. And even 37% of the people are interested in the prepayment audit requests as well. I'm going to take a look at another poll here. Hide that one and ask the question, how are you currently responding to the Medicare documentation request? All of those that we just noticed, the DME MAC, the RAC, the ZPIC, the PERM, the prepayment audit request, how are you currently responding to all of those Medicare documentation requests? 1 is, print the documentation and mail it. 2 is fax it. 3 is put it on a disc or a CD, and number 4 is third party or other vendor. So I'll give you just a few more seconds there to answer that question. And we will close the poll here and share that with everybody. For the most part, people are faxing. 90% of our clients are using the fax. 40% are printing and mailing. I guess when there's a large volume, probably is what we're seeing there. Nobody is using the disc or third-party ROI vendors. All right, let's hide that poll. Let's take a look at one more. Actually, I've got another couple here, but how many Medicare documentation requests do you receive each month? Okay. Again, you may not know an exact answer, but give me a estimation if you would. We've got 0 to 20, 21 to 50, 51 to 75, 76 to 100, or more than 100 per month. Okay. We've got 81% of the people voting already. Give you just a few more seconds. All right, I'm going to close the poll and share that with everybody. For the most part, this is going to be, of course, TeamDME customers. 75%, approximately 3/4 are getting less than 20 per month. The remaining 20% are getting 21 to 50, and then about 7% in the third category, 51 to 75. That's kind of what I was expecting. We have done a lot of work to reduce errors, reduce the billing errors, and so based on our conference call that we had about a month ago, a lot of our customers are not getting these are not getting a lot of audits as a result of that. So I think that's working very well. I'm going to hide that. I'm going to whoops. I guess I should share that with everybody. But basically, for the most part, people are getting in the less than 20. All right, I'm going to hide that poll and ask you one more. And that is, what are you hoping to gain by if you were to move to an electronic audit response solution, which is what we're going to be talking about this morning. What is it that you're kind of hot button? What is the most area of improvement that you would be looking at and see? Okay, and we've got about 33% of the people voting. 1, an improved workflow. 2, confirmed delivery of the records that you're sending. Number 3, reduction in costs. 4, security audit trail of submission. Or 5, improved reimbursement timing, which would be a lot of the prepayment. Okay, give you just another few seconds there to vote, and we're going to close the voting. Share that with everybody. What's not surprising is number 2 was the biggest thing based on our conference that we had about a month ago. The confirmed delivery of the records was the biggest one. What people said that even who only had a few audit requests is, basically a lot of times they'd send in their documentation and Medicare would say they never got it. And so that's the biggest one, but very closely behind that is an improved workflow and security and audit trail of the submissions, as well as other things. All right, I'm going to hide that. Got one final poll for you. And this is giving Francis a good idea of who's on our webinar here. What, if anything, has kept you from implementing an electronic solution? Number 1, the actual investment costs. 2, a difficult workflow. 3, transaction costs. 4, you weren't aware of an electronic solution. Or 5, you have another reason. And people are voting quite quickly on this one. Give you another few seconds there. And we will close the poll and share that with everybody. The biggest one is you weren't aware of an electronic solution, followed then by software investment cost and other things. All right, well, these are all the polls that I have to present. I'm going to hide that. And at this point, I'm going to turn the webinar over to Frances Powell. Frances is with MEA, and she's going to show us the FastAttach solution. One of the things that came out of the conference that we had about 4 weeks ago is that the number of audit requests that we were getting weren't that big of a problem for TeamDME customers, and I kind of credit our IntelliChecks that we've been putting into the system, making sure that claims are clean before they ever go. But the big thing that, again, people were saying is the confirmation of delivery, as well as some other things. So we kind of looked around for a good solution, and Frances, I think, has one with FastAttach and MEA. So I'm going to turn it over to Frances. Just a second to change presenters, and take it away, Frances.
All right. Thank you, Rick. I certainly appreciate you turning everything over, and I appreciate everyone's time today. As Rick mentioned, what we'll be walking through, the webinar portion that I'll be doing is a two-part series, really. The first is going to be an informational PowerPoint that'll go through what esMD is and the solution that MEA does have to offer as a certified health information handler for CMS. And then I'll actually do a live product demonstration as well. So that way you can see everything in real time, how the workflow would actually work for your own group. So let me just go ahead and get into the PowerPoint presentation that I do have here for us. So the first slide slide is some information, but of course some of you may be wondering, especially after that poll question, what is esMD? Well, esMD is the electronic submission of medical documentation. The program went live on September 15th of 2011, and currently there are more than 3,500 unique provider entities that are submitting their audit responses 100% electronically through esMD. Previous to the esMD program, providers were having to receive the paper requests from the review contractors and then print and mail or fax back the sensitive medical documentation via paper. To help eliminate some of the inefficiencies with that, as well as the cost and the timeliness of having to print and gather all those records together, CMS did develop the esMD program. Through phase 1 of the program, providers will still receive their request letters will still receive their request letters via the mail, but will have the ability to respond electronically to any type of the review contractor's request, including the post-payment RACs, the prepayment ADRs, CERT PERMs, and the power mobility pre-authorizations. So for providers who want to submit via the esMD gateway, you must follow 2 specific steps. Your first step is going to be to determine if your review contractors are accepting information via the esMD gateway. And the second is going to be obtaining access to the actual gateway itself. So the first thing, here's a list of all the unique review contractors that are participating in esMD. As you can see here, we pretty much have all of the groups participating. I think to date there's only 2 ZPIC zones that are not up on esMD yet. Now you can always go out to the CMS website that I do have highlighted here on the screen to review the updated list, or you can go to the MEA website at www.mea-fast.com. We also keep that list extremely current. As soon as CMS updates, we have the ability to update it as well. So once you verify that your review contractors are accepting information via the gateway, your second step is going to be obtaining access to the actual gateway itself. Now on this slide, I've provided just a little bit of information about the gateway that is there. Through the Connect open source gateway that is maintained by the Office of the National Coordinator for Health IT, groups such as MEA have become certified health information handlers. Through that certification, we do have connections and have built the gateway that gives us access to the CMS Nationwide Health Information Network. Again, that is a set of standards, protocols, and specifications that do enable us to securely submit documentation over to the review contractors in a standardized method. All of this information includes that standard use of the gateway, and just to let you know, the gateway is not funded by CMS or the ONC. One great thing about MEA providing this access through the gateway is that all of your esMD transactions are 100% safe and secure, because esMD system does use the National Health Information Network standards, in which most of those standards also go into play with your electronic claim submissions as well. So you can understand that those are pretty hefty standards out there. So MEA has built the CMS esMD gateway, or connection to that gateway, and it does give us the ability to exchange information from providers over to the review contractors. Again, our gateway did go live on September 15, 2011 as well. MEA was one of the few first groups to obtain certification for the esMD gateway. So right now we are number 5 in the nation. I'll go a little bit more into detail as we move forward. So how you can obtain access to the actual gateway itself is providers can actually build their own gateway. To date, though, no providers have built that gateway due to the technology set and the programming that is required, as well as the continuous maintenance and cost that does go into making sure that that connection is up to date, current, and 100% secure. So instead of building your own access to the gateway, you can contract with a Health Information Handler, or HIH, which MEA is. We are a certified health information handler. So just with the next area, now that I've provided a little bit of information about esMD itself and how you can use the program and get connected, I'd like to go into some information about who MEA is and the services we do have to offer as a certified HIH. So MEA does offer a desktop solution called FastAttach. And as you can see here again, as a certified health information handler, we enable providers to electronically submit documentation through our FastAttach application, and we deliver that information to CMS and the review contractors 100% electronically. Currently, MEA is the 5th largest HIH, of course that is by volume, and we regularly transmit over 1 million documents through the esMD gateway every single month. Really quickly here, we will be number 4 because we're getting at 1.5 million documents every month now as well. One of the great things is MEA is not a simple pass-through that some of the other HIHs may be for you. Instead of just simply passing through your information directly to the review contractors, we actually store and archive a long-term copy of all of those medical record submissions, which gives us the ability to have a very secure and tight audit trail, gives us the ability to confirm delivery of all of your submissions, as well as give you access to go back and view those records for up to 7 years at any time through our desktop application or through our online secure portal. So because we do keep that copy for you, if there ever was the need to resubmit, we can actually do that on your behalf without ever having to burden you with that new workflow. I'm going to move forward here for us. A couple points of distinction for MEA. Again, we're not simply just a pass-through. We do store and save all of that information for you, enabling that long-term audit trail. We have reporting on all submissions, and those reports are going to be available to you 24/7. Those reports do include just a submission history as well as the delivery confirmations we've discussed slightly before here. We also, that you may find out by talking with other HIHs or doing some research about esMD, there are some limitations that are placed on the gateway, such as certain file sizes, indexing information, and the file formatting for all submissions. But by partnering with an HIH such as MEA, we're going to take care of all of those points, those areas for you, and enable you to simply just upload the documentation, the appropriate indexing information, and we'll get it all off to CMS, the appropriate formatting for you as well. As you can see here, we do provide professional delivery for in any cases that the technology is down for any period of time longer than we would like to see, and that's more than an hour or two for us, to be honest. And we do talk with CMS daily and have daily reconciliations of all audit submissions so that we always know that your information has made it across safely and securely. Now, of course, always the big question is, how does it work? So it's extremely easy with our FastAttach application. Again, FastAttach is our software tool. It can be installed on your individual desktops or in any type of environment that you are working with. There's just those simple few 4 steps there. You can search for or enter in your patient information, upload the necessary documentation, enter in a little bit of the reference data that's available there on your letter, hit send, and you'll transmit that information over to MEA, and we'll make sure that it's all delivered to the review contractors and CMS in a timely manner. And then we, of course, will provide delivery confirmation from CMS and the review contractor through FastAttach, where you can always log into our online portal to review those delivery confirmations as well. Just to give you an idea of the esMD workflow, as you can see here that you are currently receiving your document request letter in the mail from the individual contractors. And through our Connect Gateway, you can now respond electronically to all of those audit requests. You see here. Now, there are some future use cases that we will see with the esMD program, and we'll get to those in just a second. But a couple of the immediate benefits of using the esMD gateway, of course, it's a quicker turnaround, as Rick had mentioned before. For any of your reviews, first of all, the reviews are going to be able to be much faster and much more efficient for the review contractor, so they'll be able to get back either confirmation that all the information has arrived and it was a successful audit, or for your prepayment ADRs, you will have the reduced days in AR there. We've seen that most of our groups, instead of having your 30 to 45-day reimbursement window for those prepayment requests, they've now been able to cut that down to 10 or 15 days. You also have reduced labor costs and having to get that information out via fax or via mail. For the groups that are printing any of the information and shipping, you'll eliminate all of those hard costs associated there. And then, of course, the fourth, and personally I think is one of the most important things, is that secure audit trail of all of your submissions through our HIPAA-compliant tool, as well as the certification process that we did go through with CMS. So you can guarantee that everything is nice, safe, and secure and has arrived. One of the great things about working with a partner as MEA, that we've actually been in the secure data transmission business now for over 15 years. In that time period, we've never lost a document. We've never had a HIPAA violation or a security breach. So as I mentioned just a moment ago, there are some future use cases for the esMD gateway. We, of course, are in phase 1 up here in the upper left-hand corner, whereby the document, you are responding to your document request as well as your power mobility devices. One of some of the other future use cases within phase 1 is being able to handle unsolicited claim attachment requests, or what CMS dubs the PWK, which would enable you to electronically attach any type of supporting documentation to your initial claim submission to Medicare, which would further eliminate their need to have to come back and audit you once you have returned that claim to them. Future use cases also include having to be able to do your appeals and redeterminations through the gateway, and get any type of, and register for phase 2 of the esMD program. And phase 2 will enable you to actually receive all of your review contractor requests electronically through your HIH or through a tool like FastAttach, as well as get your review results and your demand letters and any of the other additional feedback and claim status requests, as you can see down here in the lower right hand in some of the future phases. So just to recap everything we went over here very briefly, right now you can use the esMD gateway to respond to any type of your review contractor or CMS Medicare audit request. And very shortly here you'll be able to send unsolicited claim attachments to the gateway, as well as receive any type of your review contractor request as well. So at this portion, at this portion of the demonstration, I do want to go ahead and close out my PowerPoint and move to my online tool with FastAttach. I'm just going to quickly log into my application here. Again, FastAttach is a desktop application that does enable our users to electronically submit all of their audit submissions. I'm going to minimize that real quick. All of their audit submissions 100% electronically. You can see here in the middle of my screen, that is our FastAttach desktop icon. As you just saw me do to access FastAttach, all you simply need to do is double-click on this icon, enter in a little bit of login information, and you'll be returned to the FastAttach main screen that we can see here. Now on this FastAttach main screen, you have the capability to hit our recipient information button here. This recipient information button here does allow you to, I'm going to close that out for us, does allow you to review all of the different groups that you do have the ability to send information to. I am in my vendor system now, so I do have access to view a lot of the different groups that we have the ability to send to, such as your RACs and your DME Max, as you saw up here towards the top. I'm going to go ahead and hit the back button and take it to the main screen. So one of the biggest questions is, well, how do I get started with FastAttach in my electronic submissions? So how that works is the user just simply logs in and immediately can go up and hit the new search button in the upper left-hand screen of FastAttach. Once you're here on the patient search screen, you have the ability to search for any patients that have been previously entered into the system before through first name, last name, date of birth, or medical record number. Once you hit the search button, all of your search results will query below. You just simply need to double-click on that patient file. Or if you don't see any of the patients that you would like to submit an audit response on behalf of, you can simply hit the New Patient button and create a new patient at any time. You can see here we do require just a very minimal amount of patient information to create your patient file. The medical records number you do see me logging in here can be a very unique number. It could be an account number or any other type of patient identifier. And then from the sending provider, there's a drop down here, and MEA can help load all of the unique NPIs that you are billing under. Once you've accessed the provider you're sitting on behalf of, you can just simply select the recipient or the group that did, the review contractors that did request the information from you. I'm going to go ahead and pick Connolly here. They are just flying off the shelf there with all the requests. Once you pick Connolly or any type of recipient there, you just quickly need to enter in the member ID for the patient. Make sure the relationship is appropriately set, then hit next. You always want to save your changes, and once you have saved your changes for your patient file, you'll be immediately brought to our data entry screen. I'm going to take us to the four corners of the screen here so you can understand everything that's being displayed. In the upper left-hand corner here, you'll see that we displayed the patient name, their date of birth, the provider that is responding to the audit request, and the group that is receiving it. We display a little bit more patient metadata here so you can always verify that you are submitting information on behalf of the correct patient. Below here, you'll see that the claim radio button is already going to be selected for you per the recipient that you have chosen before. Since we do understand you're responding to a claim audit submission for CGS, that's been denoted. Below here, you'll simply set the dates of service for the claim in question. For any of you that are handling any type of oxygen therapy or any type of home therapy or durable medical equipment that does require future dates of service for billing, this date of service through here, you can simply hit edit date of service through, and this will take dates of service up to 90 days into the future for you. Just going to choose the one date of service today. Over here on the right-hand side, we do have a narrative box that enables you to enter in any type of internal note that you would like to save with your audit submission. Many groups make the notes such as their due date. Ooh, see a little backwards there for us. And then you can also put in any other types of narrative notes, such as if you ever needed to put this information on hold and go back and complete it later, you can make yourself a note on the type of documentation you're currently waiting for. Now, any you put in the narrative field here will not be passed over to the review contractor, but will be stored in our archived area with your submission. Above here in the reference control number area is where you will need to place the reference control number that is on your review contractor letter. Typically, that reference number is noted as the reference number, and it is a 13, a 15, or 17-digit character request number with a few dashes in it. We'll be sure once your group, if you do decide to begin the esMD program with MEA, our customer service representatives are very familiar with every single review contractor letter out there and will be able to instruct you appropriately as to what information from your letter does go into this field. Above here, where you've entered in your reference control number, is our image acquire area. You can see here that we do have several different capabilities of entering in documentation directly into FastAttach. The first that I'll discuss is our Twain scanner method. We want to give you the ability to obtain your medical records in any format that you have them in, regardless if it's on paper, if it's electronic, or you may have a mix of both, as many providers currently do. So to start, if you do have information on hard copy that you'd like to scan in, you can launch your scanner that's associated with your desktop by hitting the Twain scanner button here, and you can begin scanning information directly into FastAttach. Now, I don't typically demonstrate this in our webinars because those workflows can be slightly unique to each group. But again, you'll just simply hit the Twain scanner button. FastAttach will launch the scanner associated with your desktop, and you can just begin to scan information directly into our system. Moving over to the left here is our file import. With file import, it gives you the ability to browse and attach and upload files that you already have saved in a soft copy. File import will accept files that are in the PDF format, the JPEG format, or the TIFF file format. It works just like browsing and attaching records or documents for attachments on your email. So how it works is you simply hit the file import button. File import does enable the user to go out onto their desktop or within their network to search for the available files to include. So go out on my desktop here. I'm going to find some PDF files that I have available here. To include these in my secure audit response, I just simply need to double-click the file I wish to include, and you'll immediately be brought to our Edit Document page. You'll see here that this Edit Document page allows you to view the information that you have pulled into the system. Once you view this information, you'll just simply need to, from our drop-down here on the left, select the appropriate document type. Now you'll notice here that there really are going to only be 2 document types available for any esMD providers. The first is Audit Response, and that's what you'll primarily be labeling everything. Currently, CMS is only accepting the very few document types per the Phase 1 and the current use cases of the gateway. Now, if you are responding to a prior authorization or a Power Mobility request, you would label that information PMD Prior Authorization. So for today's webinar purposes, this is my audit response. Once I've labeled it appropriately here, just simply hit the next button, and I'll take you to the data entry screen. You can see that all 6 pages of that PDF file have been acquired into my secure audit response. Now, the second image acquire method is print capture, and print capture really is the most popular image acquire method because it does give you the ability to virtually print documentation directly in the FastAttach, regardless of the application or the file format of the necessary documentation. So how print capture works is you simply hit the print capture button. The print capture dialog box appears here on your desktop to help you track the information that you're virtually printing in. Once the virtual printer, the print capture dialog box here appears, you can begin viewing information that you'd like to virtually print in. Simply going to open up this PDF file as an example here. So once you've found the necessary documentation that you would like to include via print capture, you would simply go to File, Print, and select the MEA Virtual Printer from your available printer dropdown. Now, this virtual print drive is installed at the time that we install your software, so no additional steps are needed. So once you select this MEA Virtual Printer, you would print this document out just as if it were coming out to a physical printer in your location. So once I've chosen the MEA Virtual Printer, simply hit Print. Once that information queues up, you can see that all 8 pages of that information you virtually printed in are now available in the print capture window. Now you can certainly bring in as many documents as you would like. So if you wanted to bring in an example of a letter here, so here's a request from Connolly. Here's a little information on where that reference control number would be. Again, you would go to File and then Print. Choose your MEA Virtual Printer from the drop-down. Now let's say I have a couple pages here, but I just want to include maybe the first page of information, just like printing. Select my page range, hit Print, and now I'm going to close this out. Just the 1 page of the information that I virtually printed in has now been included. Now directly from this print capture dialog box here, you can go ahead and label your information appropriately. Once you've labeled the information, you hit the next button. We're going to automatically process all of this information into the necessary file format for your transmission to CMS. And now you can see here that we have several different pieces of information available in our secure audit submission. Now on top of print capture, we also have our screen capture capability. And screen capture is similar to the snippet or snag tools if you're familiar with them. And I like to call it our end-all, be-all image acquire method because regardless of how you have your information stored or how you can view it, screen capture gives you the ability to highlight an area of your desktop, and we make a digital capture image of it so that if you're maybe just viewing information in an online system and don't have the ability to print or use file import, you could utilize screen capture by hitting the screen capture button. You can see here the screen capture dialog box appears. I'm going to open up an example of information you may just be able to view. So here's some information that you'd like to be able to view. And instead of using any of our other image acquire methods, but if you wanted to capture this document request letter, with screen capture you just simply need to hit draw rectangle. Once the red plus appears that you can see here, you just simply need to click and highlight the area you wish to include. Once you release your mouse, you can see here we've taken a nice clean copy of that information. As you've seen us do here before, you're going to want to label your document type through the drop-down as audit response. Hit next, and now you can see, I'm going to make my screen a little bit bigger. That 11th image has now been included in our secure audit response. I'm going to clean up my background a little bit here for us. Now, archive here, archive allows you to view any information you've previously submitted on behalf of that patient. But as you can see here, it's empty because we did create a new patient file this time. But this does, again, give you the ability to view any additional information you've previously submitted on behalf of that patient before. And hit cancel and take us back out. Now, once you've recognized that you have included all of the necessary documents per the request letter from your review contractor, you can simply hit save. And you see that the case number box here appears. The case number is going to hold the case number or the case ID that's available on your request letter. It's typically a very long string of information or numerical characters followed by a 3-digit text. Once you've entered in that case number information, you can hit the next button to save it. But I would like to pause here and just simply point out to you that the information supplied in the case number box and the reference control areas are very important and are two important points of indexing information that CMS does require be accurate. But we have Q&A capabilities on our end that make sure that that information is correct. Again, once you verify that case number is correct, you simply hit the next button. We're going to process your information and take you back out to the FastAttach main screen. Now you can see here that the status of your submission is processing currently. While this information is still in the processing status, you can go ahead and hit the New Search button and begin creating a new submission on behalf of another patient. However, if you just want to, you can always just submit your audit responses off individually. I'm going to hit the back button and take us back. So you can see here that that status is going to pretty quickly update here for us. And that status, when that status does change, it will change to a status of ready to send. My vendor system is just moving a little bit slow after the holiday weekend. Might still be on holiday time with us. But as soon as your status does update to ready to send, you have the ability to securely send your information to MEA, either individually or in a batch. It's completely up to your workflow. But again, once this information is going to update here very quickly for us, and again, you can send it in a batch or you can send it individually. Apologize for the slight delay here. But once this information has been updated to ready to send, you would be able to, the send button here on our main screen would highlight for us. Oh, there we go. So to send this information, once it's in the ready to send status, you just simply hit the send button. Again, you can send individually or in a batch. It is completely up to you. But very quickly, we return a submission file receipt over to you. Once you do receive the submission file receipt, it is indication that we have securely received your audit response, and we're now making your information available for CMS and the review contractors. So this submission file receipt is going to be your first level of delivery confirmation from MEA. You can see here it's all time, date, and user stamped. We also place a unique tracking number on all submissions that go through our system. This unique tracking number helps us maintain that secure audit trail that I've been talking about. It gives us the ability to always go back and just tie back every single step of the way back to your unique submission. Just a little bit more information is available here on your submission file receipt, kind of a regular receipt here of all the information you have submitted. Now, you can print this information off for your records. However, it isn't necessary because we do have an online features area that enables you to pull a report containing all of this information if that's easier. I'm going to go ahead and close this out and take us back to the FastAttach main screen here. And on this FastAttach main screen, you can access our online features area. And through online features is where you will be able to view your delivery confirmations for all of your esMD submissions, as well as pull any type of report you'd like to see. I'm going to go ahead and close out FastAttach here and open up our online features area. Once you do hit your online features area, it will take you immediately to our search for submissions area. In the search for submissions area, it does enable you to search for all submissions that have ever gone through our system in real time. So anything that we just previously submitted for our test patient can immediately be viewed. You can search for your submissions by the unique MEA number that I highlighted there for you on your submission file receipt, through the drop-down of recipient, member information, or date range. I'm just going to search for the information I just submitted for a test patient there. Once I put in some search information and hit the search button, All my search results will query up and return to me on the next page. I've had a lot of submissions for my test patients here. So here's my test patient 14 that we just submitted information on behalf of. To view this submission, you just simply need to hit the unique tracking number. Once you hit that unique tracking number, a separate web browser window is going to appear here, and it'll allow you to view all the metadata that was included in your unique submission, as well as any narrative that you've included here. And then below, you can actually view all of the information that you have sent over to the individual review contractors. You can view them by hitting the link next to the file type and document name. And this information will display how you uploaded it. So if you uploaded one big PDF, you'll be able to view the one PDF here. This information just takes a quick second to query up because we do want to make sure it is optimal viewing for you. But not only can you view it by hitting that link here, but you can also bundle everything in a single PDF to view, whichever is going to be easier for you to view. Or if you wanted to store all this information in a single PDF in your system, we give you that capability as well. Now I'm going to leave this CERT submissions area and go to our esMD delivery confirmations area. In our esMD delivery confirmations area, it does give you the ability to run reports and view delivery confirmation on all of your delivery submissions. So you have the ability to run this report by the recipient, by patient information, the reference number, through a date range. I'm just going to run a date range here. Now you have the ability to send this information to your screen, or you can download everything into an Excel spreadsheet, whatever is going to work best for you. But as soon as you put your date range in, hit download report, if you do send a screen, a second browser is going to appear here and return your delivery confirmations to you. Now remember, I'm in my dummy system or my vendor system here, so these confirmations are simply queued up by my analyst. But you can see here that for these 4 submissions, you can see that we returned you the unique tracking number, the patient name, the medical record number, case and reference number you've included. We'll give you the actual page count of your audit submission, the MPI or the provider that submitted this information, the user with your group, and then we have your 3 levels of delivery confirmation. The first level of delivery confirmation is going to be date submitted, and this is going to be the date by which your information was submitted over to MEA. The second is going to be date CTS received, and the CTS received is simply the delivery confirmation from CMS themselves. We typically get delivery confirmation from CMS within 2 to 4 hours, and this will be updated in real time for you, so as soon as we get delivery confirmation from them, it'll be displayed to you. Now, the important thing about your CMS delivery confirmation is once you have received your CMS delivery confirmation, if you have met your legal obligation to your due date. Now, the third and final level of delivery confirmation is going to be the date received and recipient, and this is going to be the delivery confirmation we get from the individual review contractors themselves, and we typically get this delivery confirmation within 24 to 48 hours. Now, we will make sure that we follow up with the review contractors and CMS to get this delivery confirmation in a timely manner. If we don't feel that these confirmations are coming in as timely as we would like to see them, we will reach out to CMS and the individual review contractors on your behalf to confirm that everything has gone smoothly with your transmission. This delivery confirmation can be viewed at any time through our FastAttach tool or through our online portal that's available here on our main page through provider login. I'm going to minimize this here for us. Take us back out onto the FastAttach main screen. And at this point, I have walked you through some information about the esMD program, as well as information about MEAs and HIH, and then through our secure FastAttach tool that enables you to submit all of your audit responses 100% electronically and return delivery confirmation to you. So at this time, Rick, I would like to turn everything back over to you. I'm going to go ahead and give you back control, and we'll open it up for the questions, the Q&A session we discussed earlier.
Great, Francis, I appreciate that. We do have, at this point, if you have some questions for Francis, we would be glad to to answer those. Again, if you want to simply type into your screen there what your question is, then we'll ask her to address that. We do have one question from Jan that says, I did not see the Region B QIC contractor C2C Solutions. Is this correct?
Well, that's a great question. Let me go ahead and pull up our website that I had displayed here for us and give you the list of all of the groups that you do have the ability to send to here. Oh, thank you, Rick, for turning your screen back over to me. That certainly helps. So I'm just going to slide this down here. So here's a list of all of the unique contractors that you do have the capability to send to. So, Rick, if you wouldn't mind, could you please name the review contractor that Jan had the question for?
Okay, it was Region B QIC / C2C Solutions. I think C2C Solutions is the name of the contractor. Region B QIC is kind of their position or their purpose.
Sure, and it does, and we should have all of those groups available here. We do have the RAC Region B, we have the DME Administrative JB here as well, and then we have the individual smaller review contractors here as well. So, Dana, I do encourage you, if you have very specific questions about the review contractors, the capabilities, I know that my contact information will be displayed to you, and I'd be happy to go over all of that with you in a little bit more detail.
Okay. Francis, Starr is asking, does the MEA software verify all necessary documentation is there to ensure claim payment?
Oh, and that is a great question. And no, FastAttach does not verify that all of the requested information on your letter is included in the audit submission. But one of the things that we often do encourage our groups to do is, first of all, include a copy of that letter in your audit submission. And so you can kind of use it as a checklist as you do go through your audit response. And you can also make a quick note of all the information you've included in the narrative section there. But to make sure that that question is fully answered, no, right now we do not verify that all of that necessary information is included in your audit submission through our tool.
Francis, is there any way for this to be kind of a two-step process for one person to be responsible for gathering all the documentation, and then maybe another person be responsible for that final check to make sure that all that necessary documentation is included?
Yes, Rick. In fact, a lot of our groups use our tool for that very purpose. I'm going to pull open FastAttach for us. So one of the things that you do have the ability to do, and I'm just going to search for a patient I know I have in the system here, is when you do create a submission, you do have the ability to, when you create a submission for a patient, you do have the ability to put that information on hold. We have different on hold types, either attention required or for review. Enter my case information here real quick, hit next. Now this information is going to be placed on hold on your main screen to enable any of your other users to go in, double-click this information, and then have you included documents here. Maybe if you just included a copy of your letter, that gives other users the ability to view the documents you've included as well as your letter to verify that that information is correct. And then they can either turn it back over to the original user, or that person who did verify the checklist has been completed can send this off on the original user's behalf.
Okay, great. All right. Francis, Rhonda is asking, what is the cost of joining FastTrack? Now, I want to clarify, Rhonda, we don't want you joining FastTrack because FastTrack is a competitor to TeamDME. We don't want you joining FastTrack. You know, their product is FastAttach, so that's a little bit, you know, maybe a little bit confusing. But what is the cost of joining FastAttach, Francis?
And that is a great question. And one of the things that we have worked with TeamDME to provide is a special pricing point for our DME and home health service providers. We do recognize that your requests are at a smaller volume than other hospital or professional providers. plus your page count for your audit submissions is going to be slightly less. Through the research that we have done, it is typically about 20 pages per submission, where a hospital is usually 150 to 300 pages. So what we are offering is 0 upfront starting fees. So those upfront costs, again, would be waived, and they would include our software, installation assistance, and training for your entire team. And then we do have a special promotion that enables you to send your information off for just simply, I was going to pull open a PowerPoint there, but no need. We give you the ability to do all of your audit submissions for just a flat $9.95 a month. So again, for $9.95, basically $10, you can respond to all of your audit requests 100% electronically, as well as receive delivery confirmations for all of your audit submissions. Now, you can have our software installed with as many users as you need, and you can have as many users as you would like. And we will go on a month-to-month service contract with you. So if at any point you do stop receiving audit submissions or audit requests, you can cancel with us at any time.
And that's one of the real strong incentives that we had to, to work with MEA, because I'll be honest, we could create this software for TeamDME customers, but there's no way that we could do it as at the value that that Francis and MEA are doing that for you. So, do we have any other questions? All right. I just wanted to point out, as Francis was kind of going through the presentation, probably the identifying number that you would be using would be the customer account number coming out of TeamDME. And then she also talked about the various ways that you could use to attach the documentation inside of FastAttach. All of our images are saved in the TIFF format natively. And so, basically, if you are scanning images into TeamDME, then you could export those out, basically save that image. It will automatically save in a TIFF format, and then the file import that Francis showed you would be basically just, click, pull that into FastAttach, and and off you'd go. So whether you're using the imaging inside of TeamDME, FastAttach works great with that. If you are using imaging outside of TeamDME, for example, I'm sure there's a way to use another format, whether it's scanning or direct file import as well. So there seems to be some great integration between those two products. Okay. Now, Star is also asking, so just to clarify, and maybe if you have a PowerPoint presentation for this pricing, Francis, you might pull that up. But her question is just to confirm. So it's basically $9.95 per month with no startup fee, and then there are no per page transaction fees as well. And that is correct. Now, I think there is a limit to the number of transactions or pages. Is that correct?
Yes, Rick, you are correct. Again, it is $9.95, and that will cover up to 5,000 pages. And for the majority of our DME providers, you typically, that page limit is going to be just fine for you for the $9.95. Now, if you do go over the 5,000 per month, so again, that's 5,000 per month for $9.95. If you go over that 5,000 page mark, it would be 5 cents per page for pages 5,001 and above. So if you feel like you're going to have more audit submissions than, or more pages than 5,000, what we can allow you to do is our $9.95 special promotion is set up on a pretty much a per provider basis. So if you have multiple MPIs that you bill under, maybe multiple locations that you bill for that you feel would you would want to set them up as separate entities in here, we can set that up so that you can have 2 or 3 unique providers or MPIs loaded in the account, and each one of those would enable you to send 5,000 pages. So if you had 3 NPIs or locations that you wanted to bill on behalf of, they would be $9.95 each. If you wanted to make sure that each one of those locations was covered with a flat rate for the 5,000 pages per month, or if you just want to include them all for one $9.95 rate, if you do happen to go over it, it's 5 cents per page. And to further clarify, there are no startup costs whatsoever. We've waived that. We did recognize that software startup costs were a big barrier to adoption, so we wanted to give you the capability to go ahead and get started and take advantage of the program without having to incur any cost, as well as a timely implementation period. For a solution such as MEA, we can have our users up and going in 24 hours.
Okay. Francis, do you perhaps have some contact information you can pop up there for them to?
Absolutely.
I think I included that in your invitation, a link to the website, but here's some information directly to Francis as well.
And I'll make sure that Rick has a clean copy of this PowerPoint so he can send it out to anyone. But you can also contact me as well, and I'd be happy to send over a copy of the PowerPoint along with any other type of information that you would like to have about MEA and the esMD program.
Okay. Do we have any other questions? Give people just a minute. Okay, Francis, I want to thank you for making the time to do this presentation for our TeamDME customers. You know, like I said, when we did our conference call on this, it seemed to me to be pretty clear that our customers really didn't want a TeamDME solution integrated for this, because it just wasn't didn't seem to fit, I guess. And so Francis has provided us, I think, a great solution. Can't beat the pricing. So a lot of great pluses there. All right. Well, with no other questions, Francis, you've done a great job, answering everybody's question. And I want to thank everybody for joining us for the Medicare Audit Documentation webinar. And if you have any questions, Francis had her contact information up there. I'm sure she'd be glad to answer those questions. And thank you for joining us.
Thank you, Rick. And thank you, everyone.